Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to demonstrate a couple of techniques that you can use to perform self-massage for your legs and the muscles and soft tissue of your legs after knee replacement surgery. So there's a couple of options when it comes to performing massage on your body, on your legs. So different tools you can use. So first off, just these guys, your hands, you can do massage with your hands. Another thing I would recommend is if you have some sort of stick. So basically I have this small plastic handle here. You can get like a dowel at like a Lowe's or a Home Depot. You can get a massage stick, so something similar but might be a little more, have some spikes or some grooves on it. You can get that usually at a sporting goods store, of course Amazon online, but also a stick or something like this works great too. And also I like using a lacrosse ball, and then of course a tennis ball is a little less firm for someone who might not tolerate the firmness of a lacrosse ball. So let's go through a couple of these. So first we'll look at using the dowel. You could also use, for example, a rolling pin. I don't like a rolling pin just because sometimes I don't want that rolling motion. I want to actually keep that steady and push against my muscles and skin a little bit firmer. But a rolling pin or a dowel or any type of massage stick that you would find at like a sporting goods store or something like that works great. And so when we're talking about massage, we're focusing on the big muscles of the thigh, so the front of the thigh, your quadriceps, and also your hamstring muscles underneath. And then in your calf, we're working the calf muscle as well. Those are usually the most common things that tend to be tight, tend to be sore, those muscles, big muscles around the knee. So one thing I would recommend is if you do have some sort of massage lotion or oil, doesn't have to be anything fancy, but that can help if you put it, just kind of put a little layer on your skin first, or put a little bit on the dowel or the stick that you're using before, just to help it glide a little bit smoother. And then all you're going to do is, I like to start just wherever and just do these longitudinal, big longitudinal movements. So I like to work from the bottom and work my way up towards the middle of the body. Just tends to help if there's any of that fluid or swelling. Helps bring it back up toward the heart and the body to clear it out. And I kind of just work my way around the front of the thigh and the quadricep muscles. If one area feels more pressure, you can keep the pressure there a little bit longer. So notice with me, I'm holding the stick firm and just sliding it across the muscle. What you can also do is just kind of roll it more like that rolling pin motion. That might be a little less intense, but also more tolerable as well. So you work in the quadriceps, and then you can put it underneath and get a good work on your, you can do kind of this underhand technique and get the different parts of your hamstrings and the tendons and everything in there. Or you can do this, again, moving this motion like this. If it feels uncomfortable, it feels like it's pulling the skin, then try putting a little bit of lotion, a little bit of cream on there. So that's up in here, then we can go down to the calf. Obviously we don't really want to go right on the front of the shin, that's bone, that's not really soft tissue, but you can go all around the back and the sides of the calf, trying to massage the muscles, bring some fluid back, decrease some of the swelling, some of the discomfort and pain. So that's working with a dowel or a stick or something similar. Another option is the lacrosse ball. So I like the lacrosse ball, it gives a good firm pressure. If the lacrosse ball is a little too much, you can go to the tennis ball, a little less firm, probably a little more tolerable. The good thing, you can do the lacrosse ball just going all over the place, just like with the stick. What I like to do with the lacrosse ball is really finding those specific points, those focal points where this really feels tight or stiff, and just holding on that. So on the front of the thigh like this, maybe something in the middle here, Another option is, especially for the hamstrings, is you can actually, put your whole leg on the ball, so you're sitting on the ball, and use the pressure of your body weight to provide that massage. This is a little bit intense, so it might not be totally tolerable early on after surgery. And then of course you could do the same thing going down to the calf, finding those tight spots and massaging them out. Also, you could lay down. If you have a hard surface you can lay down on and do the same thing that you did with the hamstring. You can do it putting that pressure on the calf muscle as well. And then the last option, of course, is using your hands. So again, with all of this, a little bit of massage oil, cream, helps things move a little smoother. And same idea, same strategies, trying to work these big effleurage, you might hear them called from the massage world, these big sweeping motions, trying to just pull some of that fluid out, relax some of that muscle. You can use the pads of your fingers, you can use your thumbs as another option, and just doing this kind of pulling up motion, working along the leg, and then the calf as well, pulling up some of that fluid, just like that. You could also put your leg up on a stool or something in front of you if you want it out straight a little bit more. That also might give you a little bit, tiny bit of elevation, still below the heart, but at least it's not in this dependent position as much, and just doing it from here as well. So those are just 3 simple techniques, either using a massage stick or a dowel, using a lacrosse ball, or just using your own hands to provide some massage after knee replacement surgery, doing it yourself at home. Be sure to check out all our videos, leave us a like, leave us a comment if you found something useful from this. If you want to check out everything related to knee replacement, exercises, massage, frequently asked questions, management strategies, be sure to check out our YouTube page, be sure to subscribe. Thank you very much for watching.